Hey, good morning, Christian. Happy daylight savings time.
Good morning, Eric. You as well. How are things
What's up?
going today?
Good, man. Good. Got my coffee. I'm enjoying this holiday like none other. Turn the clocks back. No, forward.
Forward.
Turn the clocks forward. Yeah. No, I think the person that's feeling it the most actually is my dog. She is, I showed you before the stream. I held her on my lap and she looked demoralized. Like, what are we doing? And now I look behind me on the bed and she's passed out. Yeah. So, anyways, I think out of anyone right now, Willie is feeling the effects of daylight savings time the most.
Yeah, and as dog people, I don't think there's any better argument to dissolve daylight savings time for the
Yeah.
health of our pets.
Yes, yeah. Let's start that petition. But yeah, no, dude, things are going well. Just cranking away at some different projects. I'm trying to enjoy what is almost golf season here in Minnesota. I was about like it's going to be in the 60s today, and I'm like, man, I was really close. Some of the courses are opened up around the cities. I'm like, I really want to go. And then yesterday woke up and we got like 2 inches of snow. I'm like, not going anymore.
Yeah, we're still a couple months away,
Yeah, you guys got
mainly because of mud season. Do you guys have mud season in Minnesota?
I mean, it gets wet out there, but not like I wouldn't call it like mud season though. No.
Yeah, I think you guys have better dirt. We don't really have dirt. We have granite and sand and then like a dusting of dirt.
Yeah, we
So
got a
things
lot
are
of
just disgusting and
black
they
on
fall
it.
apart.
Yeah. Yeah, we got a lot of really nice dirt. Things grow well here. Things grow really well.
Oh, says the guy who lives on a farm.
Yeah, right. You want to talk about planting grass? It's pretty nice to just throw down some grass seed and you got some nice black dirt and
Yeah,
you
you
don't
can
got to
watch it
worry
grow
about it.
before your eyes.
Yep.
Just that.
Especially so it's nice. Anyways, this podcast today is not to talk about how nice it is to grow crops and grass in the Midwest. We're trying to talk about, let's say, I guess, different lifting techniques when it comes to low back. I guess you could say legs too. I mean, we're talking about like squats and those different types of things. But Christian and I, well, actually, Christian, you found these videos and they're interesting because they're two kind of completely different sides of the coin when it comes to squatting and different techniques and what's healthy for the low back, what's not healthy. And so we're going to discuss kind of the contrast between the two and where we sit with our beliefs in it. If you've watched our podcast before, you probably guess where Christian and I are going to be leaning on this. But it's just a good kind of like I said, two different sides of the coin when it comes to lifting techniques and what we think about the low back.
Yeah, so we're going to start by reacting to a video titled But His Back by the Back Guy. I haven't followed him a whole lot, but I've seen a few of his videos pop up in my algorithm, and I like his content, the stuff that I've seen so far, and this video is no exception to that. I really did enjoy this video. And then going off of that video, there was a post recently, 2 weeks ago, from Squat U on his YouTube page going through why rounding your back and spinal flexion is bad and why people like us get it wrong. And so we're going to use that to also guide some of the conversation. All
I
right,
love it.
Eric, let's start with the reaction to the Bat Guy's
Yeah.
video. What did you
Yeah.
think?
Yeah, I mean, I thought it was my initial reaction was the guy, he looked like he was probably like younger 20s. The guy that was doing the lift, I was thoroughly impressed by. Like that's impressive.
A
I was
Zurcher Jefferson curl with
yeah,
385 pounds?
yeah, that was
Jesus.
insane. That was insane. I'm like, yeah, that's impressive. And I would assume he's done a pretty dang good job building up resiliency in his not just his lower back, but his hamstrings. I don't know if you noticed, like in the video, his knees are pretty. His his legs are in a position where I would presume a lot of that force transfer is being done through the hamstrings, right? Because his knees are pretty much locked out, and a lot of it seems to be sitting back on his heels. So I'm like, dang, low back. That's one resilient low back, but those hamstrings, they must be doing a lot of work too. So but yeah, I mean it looks like a scary lift, right? When you see someone do that 385 pounds where you're Jefferson curling up with the weight in your elbows, using the back and the hamstrings and the glutes and coming up to a standing tall position, yeah, that's an impressive lift, but also from first look, that's also seeming like a pretty scary lift. But like I said, if you have the right program where you build up the resiliency and you make things strong in the right places, why not treat it just like any other part of the body, right? So that was my initial thoughts to it.
Yeah, I think the back guy goes on to describe a core belief of mine, I think yours as well, is that as long as you slowly progress someone into these movements and you spend a lot of time building up that strength and that fatigue tolerance, as he put it, to these different positions, you are way less likely to get injured in whatever position that might be. And we know through injury prevention research, as well as, I guess, tangentially through strength and conditioning research, that if you train your body through more range of motion throughout your joints, more stretch on the muscles with progressively greater load over time, you are less likely to get injured. And so that general guideline, or even like rule, I would call it at this point, applies to every part of your body. Yes, of course, there's going to be some nuance there. Your knee joint is not the same as your spine joints. Like there's differences there, of course, but like the principle still applies. And to disregard that principle is, to me, foolish. And you do that at your own peril. Because like the core thing that I think people take for granted is like, if you show that video to a little kid who hasn't been told that rounding your back is bad for you, hasn't had a low back injury yet, they're probably going to think it's cool or like just disregard it entirely. They don't have this visceral emotional reaction to rounding their spine because they do it all the time. They don't think about it. They don't have the cultural bullshit going in their mind about how this is a terrible position for them. That stuff comes later when you hear stories from people who've hurt their back and they tell you you can't do any BLTs or bending, lifting, twisting. And if you do, your back's going to explode. And so like, I just think it's really important for us to always factor in how much these cultural expectations or norms at this point feed into these beliefs around these issues. And it's our job, Eric, it's my job, your job, to continue to combat this stuff so that people don't get hurt because they're avoiding these movements altogether.
Yeah. I mean, I think it's in the same sense. It's like listening to stories of, someone in their 60s playing pickleball, and let's say they tear their Achilles, right? And they, because they're stepping backwards to go hit a ball, and they step back, and it's a strong eccentric force, and they're in their, they're older, and so we have these age-related changes, and maybe they have some weak parts of the tendon and the strong parts fatigue out, and bam, there goes their Achilles, right? Just because that happens, I don't know what the percent it would be, if we even know, but I would assume a small percentage. But it's like when it happens to someone, the word gets around and people talk about it, right? I only know of this because I played a lot of pickleball down in Winona at my last job, and then moving up to the cities, it's like you're treating patients who play pickleball, so you hear about these things. But my point is, just because you hear of some individuals having these pretty nasty injuries playing pickleball doesn't mean the whole pickleball community stops playing pickleball, right? And I think the reason why is because we understand that, like, just because that person tore their Achilles doing this movement doesn't necessarily mean it's going to happen to me, right? And I feel like it's the same, like we should apply the same idea to when it comes to like lifting techniques in the low back. Like you hear about someone who might have injured their low back because they tried to move X, Y, or Z or lift X, Y, or Z, right? And they tweak their low back and then they have a lot of low back pain. Just because that happens to someone doesn't mean that we should avoid it altogether. And so I hope I did a good job explaining that, tie that all up. It would be, we should be training, if you're a pickleball player, you should be training some strong, longer hold, longer held isometrics for that Achilles tendon to make it nice and strong and reduce your chances of having that injury. Maybe do some, eccentric loading in there as well. Same thing when it comes to the low back, right? If you are I think right now the most similar population I'm seeing low back pain in the clinic right now is middle-aged blue-collar workers, construction guys, right? Guys in their 40s, 50s that work hard construction jobs. And same thing applies to them. Just like how a pickleballer might want to really strengthen the crap out of that Achilles tendon and train it in an eccentric way so it's withstanding those forces. Same thing with these guys I'm seeing who come in for low back pain, who work construction jobs and they're lifting heavy weights in really awkward positions, we should probably be training lifting heavy weights in awkward positions so we can not get these low back pain episodes for individuals who work these, construction jobs or what have you, right? That's just one example of many of individuals who get low back pain. But anyways, that's the end of my rant on that one. I think the two things are very similar. Just because people tear their Achilles playing pickleball doesn't mean we all stop playing pickleball. Same thing
Yeah,
with low back.
it's like when you tore your meniscus playing basketball. Should everyone stop playing basketball forever because you can tear your meniscus or you can tear your Achilles or
Mm-hmm.
your patella or quad tendon? Like these things are going to happen. These are inherent, or these are common injuries inherent of certain sports, and everything that you do carries risk. And
Yeah.
the way that you reduce the risk or you prevent injury is you acclimate your body to the stressors that you intend to impose upon it. And now it's not like I'm going to create a training program for someone about to go move a couch at a friend's house. Like that's not a thing I'm going to do. But if in your normal strength training routine that you do throughout the week, you incorporate some low back training, whether it's through back squats, deadlifts, some kind of like flexion based row, things like
Yeah.
that to have a strong, resilient low back. It doesn't take much to have that resiliency. And then if you, or when you go and help that buddy move the couch and it's like awkward, you got to bend low, your back is rounded because you can't do it any other way, and you're going up and down a staircase, whatever it is, you are better prepared to handle that than someone who has never done that stuff before. And like
Yeah.
a recent example of this is my sister-in-law and I moved a bunch of firewood when she was helping us out once Felix was born. And we were just stacking wood. So like, of course, you're going to bend over a lot and stack wood repetitively. We did it for, I think it was 45 minutes. Dude, my back felt fine. I felt nothing. I felt nothing at all. But she, who doesn't exercise at all, except for like some biking and walking, she does no strength training, her back was in shambles within like 15 or 20 minutes. And she powered through because she wanted to. And, I was like, all right, fine, I guess I'll let you, even though I probably shouldn't. But like, she didn't have any fatigue tolerance. And her back was wrecked for like 3 days after that because she doesn't train it. My back, I didn't feel a thing that night or the next day doing the same kind of work because I exercise my back regularly. So like, the exercise that we do prepares us for the things that we have to do in life. And that's like, I guess the general moral of this reaction video is if you want to make sure that you can handle flexion-based loading, you should be training some of it. Do you need to go do Zurcher Jefferson curls, freaking elbows to floor with 385 pounds? No, that's overkill. I'm not saying you have to do it that way. That's definitely an exception to what we're saying.
Yeah.
But
Yeah.
something related to that every once in a while is going to yield a ton of improvement for you.
Mm-hmm. I agree. Which I was gonna throw this out there too. My side note, we are coming up on 1 year since I tore my meniscus in my left knee. I believe it was like around like the third week in March of last year. And so coming up on the 1 year, and yesterday I ran 2 miles. I did 4 sets of 5 of like 295 back squats. I did some lunges and step down, some Peterson squats. It's like, you know what? Conservative measures around a torn meniscus, totally fine. Back to where I want to be, man. 1 year out. We're just cruising now. We're good. So that's my little side note when it comes to having a soft tissue injury like a meniscus tear. We don't always have to jump to surgery.
Right. Well, and it didn't take you a year to get feeling pretty
No,
good. That's just like,
I was
yeah,
doing this like 6 months ago. So
exactly.
yeah,
Exactly. Yeah, you were doing good stuff
but
back then.
yeah,
Well, yes, like
um,
even 6 months out, year out, like, dude, you're good. Most of the time,
yeah,
things are going to work out, which this is a
yeah,
really good segue into squat use related post to this reaction video.
yeah,
For anyone that doesn't know, Squat University puts out a lot of content around maintaining a neutral spine whenever possible. He's very anti lumbar flexion in general. There are some posts you'll see where he's kind of okay with it, but the general message you get from him is if you round your back with any amount of repetitive load, you're doing something wrong, you're going to get hurt. You're playing with fire, I think is one of his quotes actually later on. So he made this post about how flexion's terrible, and here's something he said. He said, full spine flexion equals increased shear forces. The low back muscles lose their ability to protect the spine at full flexion, shifting more strain and force on the discs and ligaments. Let's just talk about that for a second. Any immediate thoughts with what I said there, Eric?
Yeah, my initial thoughts whenever I think about someone talking about the low back in this light is, what about other body parts?
Yes.
I mean, think about when you do, like an overhead press or any type of lateral raise at the shoulder. I mean, when you're out perpendicular to the body, how much how much force are we putting on the rotator cuffs, right? Like how much I guess theoretically, if we're going to be just talking about theoretical stuff right now, when that hand is all the way out to your side, I mean, how much gravity is pulling on that humeral head, causing shear forces at the shoulder joint? And how much stress is it putting on the rotator cuffs? And, all these other things where, and then that's not even assuming we're doing appropriate amount of resistance. What if people are doing too heavy of resistance, right? And so we can extrapolate this theoretical idea of you're in a extreme position at a joint, and we can extrapolate that out to any other joint and talk about it in the same light. And we can demonize every single movement if we want to, right? Because I mean, maybe I'm not up to snuff on my research here, but this whole idea of like bending completely forward, elongating the lumbar paraspinals and losing their ability to protect the low back, and then we're causing more shear force in the lumbar spine. Like, is that extrapolated out into any actual relevant clinical data? And I mean, I'm sure Squat, you or someone in his position that believes that way, Stuart McGill, et cetera, like they would all probably say, oh yeah, we have plenty of research to show that. And then, I would very clearly point to Peter O'Sullivan's research or someone else's research that's more up to date and a little bit more robust and say, well, what about this? It completely contradicts it. So to me, when we make these claims, it's like we're looking at a kinesiology book, and we're extrapolating out these theoretical ideas and then applying it like it's true clinical data. And then, we, like I said, we could talk about it in the hip joint. We could talk about it in the ankle joint. I mean, I just went on a little rant about pickleball players and their Achilles tendon. We could talk about extreme dorsiflexion, eccentric loading at that Achilles area, right? In a closed chain motion. And so to me, it's like, why do we demonize everything when it comes to the low back? But then any other time we do an extremely end range of motion loaded position at some other joint, it's completely normal and we shouldn't think twice about it. So that's my thoughts around it, is if we're going to make these claims at one part of the body, and then let's start talking about theoretical stuff at every other part of the body. And why don't we just all live in bubble wrap and never move any body joint, because it's going to be so terrible.
Yeah, well, I'll comment on that I'll comment on that after I make the next thing. So he goes on to say that the disc is not the same as the hip, knee, shoulder, or elbow joints. Those who claim the spine is just like any other joint is dead wrong. Comparing the disc to a shoulder, hip, knee, elbow type joint is a leap in logic. They do not adapt, respond to load, or heal the same way. Disc injuries scar poorly, never fully recover, while synovial joints remodel or heal better. Synovial joints meaning like your elbow, your shoulder.
Yeah.
All right, so this is a really good point to bring up, because I was going to make the example of, in the previous thing, he was saying how low back muscles lose their ability to protect you at full flexion because the muscles are really stretched out. They can't contribute as much to the support, and so it shifts the strain to your ligaments and your discs. By the way, your discs are basically ligaments, so you can think of them similarly. And it's like if you roll your ankle. If you roll your ankle, your muscles and tendons got overstretched, and then your body had to rely on the ligamentous support to prevent an injury from rolling your ankle. It's not inherently bad to expose your ligaments to stress. They are there for a reason. They are there to take on that stress. And your muscles, your tendons, your ligaments, they all work in unison. They work in tandem with each other, maybe at different points in the movement or controlling the movement. Sure, but they're part of a system to support you. Some things take on the stress earlier throughout more of the range of motion, which are your muscles and your tendons, and then others take on that stress more at the ends, at the extremes of the range of motion. Those are your ligaments, but they all are required to support you. And the really cool thing about all these things is that they all adapt. Your muscles can get stronger in response to stress, but so can your tendons and your ligaments. The major difference is going to be the stimulus you need to provide to the tissue to get them to get stronger and the time frame that is required to get them stronger. So muscles get stronger much faster than tendons or ligaments. I forget the exact numbers, but like you can get a muscle stronger in like 4 to 6 weeks. Like under a microscope, looking at the actual structure of the tissue, as well as like doing tests to it, you can tell that the muscle can handle more force. Tendons and ligaments are closer to like what, 2-3 months and beyond, because they have a slower turnover. They don't have as much blood supply. They don't have as many cells embedded within them to make the tissue stronger. They're more of what we call a passive structure. They aren't truly passive, but they're more passive than muscle. And so you just have to set your expectations around the timeline for adaptation when it comes to thinking about how to improve the durability of your ligaments or your disc in this example. And so, of course, Squat U guy, the disc is not the same as your knee or your hip or your shoulder, but they do adapt. You can see this happen under a microscope. We have studies that have done this with cadavers or with like looking at the thickness of the discs over time in people's lifespan, this kind of stuff. He says disc injuries scar poorly, never fully recover. Well, dude, that's like any injury. Like if you tear fibers in your tendon when you're over the age of like 15 or something, or you tear ligament fibers, they never fully recover to the exact same degree. Look at your skin. You probably have scars from your childhood. Did that recover fully? No, dude. That's not how your body works. But it doesn't need to recover fully, meaning like return back to its pristine baseline that you were born with. That's not a thing. But if you have compromised fibers in your tendon or in your ligament or in your disc, they will heal some, and they will then be able to provide you some resistance to tensile load. But you know what really truly happens is all the other fibers around it can get conditioned to be even stronger than before. And so that the whole system is better than pre-tear if you do it right.
Yeah. I think it's nuanced, right? Kind of like how you expanded on all that there, Christian. Like it's all nuanced, right? It's the two things I think about in regards to how the low back or discs don't fully heal like synovial joints. One, I don't think we give the discs enough credit, regardless of injury or not. Just to throw this back out there, discs are not like jelly donuts. They're more like car tires with wet cement inside, right? Like they're strong, they're robust. They're not this like squishy little cartoon jelly donut like we like to think. We can get that BS out of here. And so discs are strong and robust. Second, I mean, I know this from personal experience, but also just from looking at countless of patients' images on MRIs and whatnot after they have some type of shoulder, knee injury, etc. in a synovial joint. And this is when I start to think about like how much do like Squat U put in time in regards to like boots on the ground in the clinic, seeing people, 10 to 20 patients every day and like, looking at MRIs, looking at, doc reports, etc. Because there's a lot of times that I see patients' imaging reports that are peripheral synovial joints and they have chronic injuries. And guess what? There's a lot of fatty infiltrates. There's a lot of there's a lot of changes in the tissue content. Like, I don't know what we're talking about in regards to synovial joints have a much better like chance of healing fully or whatever that like he was alluding to, but like I don't think they do. Like when you practice in the real world and you look at these like patient after patient and you're reading these imaging reports or you're reading these doc reports and it's like, yeah, they have this long-standing injury. Guess what? The joint has like 2, 3, 4 things kind of quote messed up or abnormal about it, right? Like I don't think that was healed properly, And so I don't know what that whole point is. And then third point is I'm just pulling up my PowerPoint here that I gave to the residencies students the other week. Um, we know pretty well, and these are going back to a couple of studies, one done by at Duke University, and then another one done as a recurrence of low back pain is common from De Silva et al. And the statistics around low back pain, like 90% are going to get better within like 3 weeks, which is crazy, right? 67% are going to have recurring low back pain within like a year, right? And so what that shows is, I guess, kind of to his point that the low back can have recurring low back pain. But second to that is that 90% get better within just, within a month's time. And so if we're thinking about like, oh, the low back doesn't heal very well, and so when we do these extreme positions, we're making it prone to being hurt forever, blah, blah, blah. It's like without any intervention, majority of low back pain gets better. And so, I mean, to your point, Christian, like the story you told about your sister-in-law, she had a sore back for about 3 days after moving wood. It got better, right? It didn't stick around and plague her for years on end. It resolved itself within, a couple of days. And so this idea that the lumbar spine and discs are this magical thing that is never going to heal unless we do the exact right thing, I don't quite buy it, especially when you think about all the other joints in the body are apparently this magical healer that goes back to normal. No, probably not. A lot of joints, like you said, Christian, look at your skin. You have a scar on your hand. That didn't heal back to normal, right? These things don't necessarily heal back to some pristine condition, but they recover and they get better to do their job, right? Like you get a scar in your hand. Yeah, it's not back to where it was when, before the scar was there, but it's there, it's protecting you, it's thermoregulating, it's doing all the things that any other part of your skin throughout your body that doesn't have a scar on it was meant to do. So just because we might have hurt a disc or something, when we were 21, doesn't mean that disc is now going to be the bane of your existence for the rest of your life. It can still do its job. It can still become more resilient and strong, and just like any other part of them.
Yeah, I think your example of that study around 90% of people with low back pain end up getting a lot better over whatever length of time. I think it's good to qualify what better means. Better means that they don't have pain or like very little and they're back to doing the things that they actually want to do.
Mm-hmm.
In Squat U's world, better means, is there forever a change on an image? And it's like, those two are not the same. If you herniate a lumbar disc, you are going to have a change in that disc forever. Whether you did it with doing a Zurcher Jefferson curl or you did it sneezing, like it's forever going to be different. You don't expect it to heal exactly to the same condition that it was pre-injury. That's not how your body works. You get wrinkles on your skin, you get gray hair, you get arthritis all over your body. Things change over time. That's just part of being human. What you really care about is, can the person get rid of their pain and can they get back to the things that they want to do, if not beyond that? And when it comes to really any injury of your body in the musculoskeletal world that we deal with day to day, like a lumbar disc herniation, like osteoarthritis, like a ligament sprain, muscle strain, people get back to everything and more if they really wanted to put the time and effort in. And so I think Squat U does a really bad job of being clear about what he means by healing and damage. He means healing and damage based on an image that you take of someone's spine, not do they return to the things that they want to do. Because in our world, the imaging doesn't matter. Like you're saying, Eric, if you look at anyone's image you see day to day, because we look at scans every single day, all the time, there's always stuff wrong. Like it's just, that's how it is. And I love your example around like orthopedic injuries at other joints. It's like, yeah, dude, like have you seen how many total knee replacements and total hip replacements are done every single day, every single year in the US alone? We aren't doing spine replacements. We're doing the diarthrodial, synovial joints that he was saying are not the same as a spine. We're replacing those ones. We see those things happen all the time. Those joints, quote unquote, wear out. People get arthritis there. They have to get that stuff replaced. It's really the only way that they're going to feel a lot better at some point. But we also see people come in with really bad arthritis in their knee, for example, and we do exercise and we help them get back to everything that they want to do. They feel amazing afterwards. Did we change that arthritis? Did we fix it? with exercise? No, we didn't touch it. We just taught your body how to ignore it again. It's there.
Mhm.
But arthritis is a complex issue. It's not like you're just grinding bone on bone. Most of the pain that people feel is just because of the inflammation of the joint lining itself. And that's where exercise can calm that down and teach your body how to put that arthritis back in a dormancy, so to speak. So, bit of a rant, bit of a tangent there, but I can't stand this guy's stuff right now. Just
Yeah,
so
yeah.
I just wanted to finish on the last comment here. This one's gonna piss you off, dude. So he says,
I have some stats to bring up too, by the way, once you say this.
good. Okay,
I
good.
have some
All
more
right.
stuff.
So flexion movement isn't evil. Your spine
Mm,
needs it.
okay, I like it so
But
far.
you have a limited flexion budget. Save your budget. Build a rock
Oh,
solid core to resist flexion while you generate hip power. Don't waste flexion on heavy loaded movements that stack damage. To me, this is the whole like Trump quote early on in his political career where he was talking about like how his energy is like a battery and he just doesn't ever want to use it all up. And so he's got to pace himself. It's
mm-hmm.
like, you don't have a flexion budget. What does it even mean?
Yeah. So I'll get to that, but I do want to just bring up real quick, going back to our last stuff about imaging and how like getting better is supposed to be reflective in like better imaging or what have you. I just want to bring this stat up. Study done in, I believe, the Journal of American Radiology. I probably butchered that, but American College of Radiology. There we go. From Leonard and Bree, and they showed that asymptomatic individuals with imaging over the age of 60, 36% had a herniated disc, 21% had spinal stenosis, and 90% had what would be considered degenerative changes. And they didn't have pain. And that is in people over the age of 60. Things happen. Body changes. People are still okay.
And I bet like 0.1% of those people did any sort of heavy flexion loading of their spine. It's like
Yep.
not a thing that people do, and they still had all
They
those
still
things
did it.
happen.
Yep. It's not pristine. It's not going to happen. It's not how the body works. From the day we're born, the body is going through a constant state of catabolic and anabolic repair and breakdown. Things don't always get back to normal. Very simple. That was an idea that I learned in undergrad, when I was like 19. Like, these are very simple ideas that we learn about catabolic and anabolic properties within the body that happen just because we're human and we're living things. And when we have those living aspects to us, we don't always go back to normal, whatever normal is. It's almost like the more we talk about this, it's like, what the hell is normal? So is normal what our bodies look like when we were little infants and everything was like pristine and shiny? Is that what normal is? Or is normal like the study I said, when you're 65 years old and you don't have back pain, but you have these age-related changes in the spine, and the doctor goes, I don't know how you don't have pain. Look at all these terrible things with your spine. Is maybe that normal? I don't know. Anyways, talking about the flexion capacity budget. Yes. I'm gonna relate this to physiology, and I hope I get this right. But it's not like we have like a glycolytic budget, right? It's not like a glycolytic capacity, once you use it up on a run, goes away forever. No, the body builds it back up when you rest. It recovers it, right? You eat some carbohydrates, it restores it. It's not like you use up some muscle glycogen and the body's like, well, buddy, I don't know what to tell you. Hope you don't get chased by a bear soon because we don't have any energy left.
Better be a
No,
slow
the
bear.
body repairs it, right? It stores it back up. Same thing with the lumbar flexion. You move, you bend, you load the spine, and you take a little break. You maybe do some nice stretching, maybe do a nice little sauna session, maybe do whatever you want to do. Doesn't matter. The body is going to build it back up, right? It's going to go back to its job and save up some money in its little savings account for this lumbar flexion budget. And then within a day or two, you're going to have another budget to spend whenever you want. And if you did it right, that budget maybe will actually grow a little bit day by day, training session by training session. And so that when you have to go build a log cabin out in the woods, you have so much freaking lumbar flexion budget that you can build a log cabin and feel completely fine, right? That's the idea. And so this limited flexion budget, I don't understand where that comes from. And the last thing I'll say about this rant is that none of that of what I said is very much like research backed. That's just my own ideas. So I'm just kind of talking in terms of theory right now. But it seems like a lot of stuff with around the low back and demonizing different movements throughout the body, a lot of it seems to be based off theoretical ideas. And so why not just keep on that trend?
Yeah, I mean, like I I do think you have a flexion budget. I do. But you know what happens is when you start to get close to the end of that budget and you rest and you recover, you get a raise. And now your budget is bigger. And now you have more of a flexion budget. It's like, do you have a running budget? Sure. I can only run so much right now before I have a lot of pain or fatigue, whatever happens. But when I run and I go to sleep and I eat and I wait, my budget goes up. I got a raise. Now I can run more. That is how this works. This is how your body works. Does your ability to get a raise and move your budget forward change over time? Yeah, sure. It changes to some degree as you get older, but everyone can get a raise with their flexion budget over time. So like this, I don't know, man, there are some times where I do say like, yeah, I think Squat U means well. I think he does a lot of good stuff for the profession. Then I read stuff like this and I'm like, I hate you. I hate you.
Yeah.
I'm so torn on him. I really
I
am.
think,
Drives
like
me
I said
insane.
before the podcast, I think that he has really good content around like body mechanics, just purely working out, right? Where he's not talking in light of things that seem demonizing or putting things in a bad light when it comes to the body in terms of rehab. When he's just purely talking about like mechanics and working out, I'm like, yeah, this is good stuff. Good stuff. But then whenever we start to get into these low back pain treatment ideologies and beliefs and or any other parts of the body, it's like now you're losing me. Now you're losing me. And so he seems like a very well-read guy and obviously has very thought out ideas and beliefs. It's just, I don't want to say like it's wrong, but it's like some of the things that he's propagating. There's very clear research in regards to fear apprehension and catastrophizing movement and medicalization of images and all these things that we know are not good for patients seems to be propagated in his messages. And so it's hard to stay on that train when you see that stuff.
Yeah, this is not to be an offense to any personal trainer at all, but like he reminds me of the personal trainers that you meet who are great at doing the training piece, but then they start to like get too confident and they dip into the
Yeah.
I'm also a rehab guru kind of person and I can do it better than your physical therapist can. And it's
Hmm.
like, I mean, maybe sometimes you can. Sure, I'm sure you had a good idea here, but like,
Yeah.
that's not how this works.
Right.
Squat U reminds me of those kinds of trainers where he's really good at certain things, but then once he starts getting into the actual injury prevention science around human movement, I'm like, I don't think you have read that much about this stuff, or the things you've read are really just to support your own biases. You aren't actually trying to branch out and become better.
Yeah. I Yeah, last point I'll make, and again, this is this is gonna sound bad, but this is like it reminds me of like I remember being an undergrad and learning things about the human body that just made sense, right? They just made sense visually, contextually, theoretically. It's like this stuff just makes sense, right? How the body moves, what's weak, what's tight, what's strong, what's overactive, what's all these like catchphrases that like if you asked someone like, can you really explain what it means to be tight somewhere? I don't think we would necessarily be able to get an answer out of pretty much anybody. It's just these catchphrase type words that just make sense to us when we say it, right? And like you learn those things in undergrad as a 19, 20-year-old kid in undergrad, and you're just like, I understand the human body to its fullest. I can tell you exactly why you hurt and what's wrong with you and what you should do to make it better. And like that's what this reminds me of. And then it's like you should try that in the real world in a clinic. You should do that. Have someone come in with debilitating low back pain and you should lecture them about how their core is too weak or how their posture is bad or how, they did this to themselves because of X, Y, and Z. And then with that same person with debilitating low back pain, you should try and have them get into some type of side plank, or you should have them try and do some type of, core stabilization thing or whatever it is, and see how that goes. It's not going to go well for you. And then that's when real life kind of slaps you in the face and you go, maybe I didn't know everything. Maybe these catchphrase words and these very simple theoretical ideas are like one sliver of a slice of pie. And there's a whole mess of pie that you have to figure out and learn and be good at to really, really treat someone with these types of issues. So that's what this reminds me of. And that's why I get fired up about it. Because if it was this easy, physical therapy degrees should be 2 years and no one should ever have pain again, because these are very easy ideas to implement. But when you implement these very simple, straightforward, easy ideas, it doesn't really get that many people better. So we got to scratch and claw. And that's why, Christian and I are years out of our doctorate program, and we're still continuing to read up on research and learn, because even being this far out and continuing to read and learn about things every year, we still don't have all the answers. And so to just make something seem so simple and easy, it feels almost like a gut punch to those of us who are actively trying to figure this thing out with the most up-to-date research versus being stuck in the 90s with these very simple ideas that we know just don't work now.
I agree. Nothing else to add there.
So that was a lot of heart in that message. That was a lot of heart in that message there. That was, can you tell that there was a wound that got opened up during that?
I mean, absolutely. And like the truth is that we have done this. What do you
Yeah.
think I did my first 2 years of clinical practice? I gave
Right.
everyone core stability. I did all the things. Oh, you have disabling low back pain. You've been to PT before. You did all the core stability. Well, let me just do it harder. Let me coach you better.
Yeah.
No, dude. Like at
It's
some
not
point you got
that.
to recognize it's not that. There's other stuff these people have to do. There's other reasons why they hurt.
Mm-hmm.
And you can't keep playing the same old freaking tired record. You got to do something different.
Yep. And then the last thing I will say is, if all these ideas, and we've said this on other podcasts, but I'll just reiterate it here. If all these ideas were truly working, and then why do we continue to see worse and worse rates of low back pain year on year, and see the cost of healthcare dollars and healthcare utilization continue to go up? Annie walked in, so Willie's freaking out. Why do we see these things continue to rise if all this stuff was supposed to be the truth, right? If that's the thing. And then I don't get it. So clearly we're still missing something. Like I said, that's why we're continuing to read up on things and continue to try to be better.
Well, that's a wrap, dude. Thank you.
Yep. Sounds good, man. Well, I appreciate it. This is my cue to go take Willie outside now that she's up from her slumber and let her go to the bathroom.
All right,
All right,
dude.
dude. You have a good rest
See
of
you
your
later.
day, Christian. We'll see ya.
You too.